So the year is 1952 and a vaccine is discovered at the University of Pittsburgh in Pennsylvania. A vaccine which prevents the contraction of polio. In 1985, some 30 years later, there were still 150,000 cases of polio recorded in India alone. Fast forward to January 2014, another 30 years, and 62 years from when that vaccine was first discovered, the Prime Minister of India, a third world country and the country of my birth, finally announces the eradication of polio. Well, what an amazing achievement, and all thanks to the hard work of doctors and the wonders of modern medicine. Am I correct? Well, not entirely. In fact, to a large extent, it was due to the combined efforts of the Indian government, Rotary International, and the Bill and Melinda Gates Foundation, who together found a way to effectively deliver, I repeat, deliver, a treatment which had existed for the past 62 years, and in doing so prevent a lifetime of misery, anguish and suffering for many, many future generations. Now the year is 2017 and the country is Australia, a first world country. Two men, one from the city, the other from the country, wake up one morning with a dull pain in their chest. The first man picks up the phone and makes an appointment. He ducks out on his lunch break to see a cardiologist. He steps onto a treadmill to have a cardiac stress test, and the test is grossly abnormal. He's rushed to hospital where he undergoes open heart surgery, and he survives, much to the relief of his wife and young family. Well, the other poor fellow, well, he lives 1,200 kilometres from the city. He faces a 3-day round trip to see a cardiologist and have a stress test. And his poor wife's recovering from a hip replacement. And as it's just rained, there's crops to be planted quickly, which only he can do because recent times in drought and financial pressures, it's meant fewer workers. So he reluctantly resigns himself to the thought that, well, maybe this pain is just reflux or indigestion. The next day he fails to come home and he's found dead in a field, clutching a handful of antacids. He leaves behind a grieving wife, a young family, a struggling farm and a community in distress. If only he had access to a stress test and a cardiologist, a test which has existed since the 1950s. If only then he too would have a chance of surviving. You may be surprised to know that in Australia, a first world country, if you live outside our major cities, you're nearly twice as likely to die of heart disease. And it's not because we don't have the medicine or the treatments to help those people. It's simply because, to a large extent, we haven't found a way to effectively deliver the same medicine, the same treatments, which people in the cities have had at their doorsteps and to some extent taken for granted for generations. We should not tolerate health inequity such as that simply due to a lack of services. We need to sort out the delivery chain, and we should do it because we can do it. And that's where the Heart of Australia truck comes in. I built a 25-metre cardiac and respiratory clinic on wheels to bring not just people like myself, specialists, but all the equipment you need to the heart of those remote communities. From ultrasound machines to cardiac stress testing machines, heart rhythm monitoring machines, lung function testing machines, sleep apnea testing machines. Essentially everything you'd find if you were to walk into my city cardiology practice. And what it means in a very practical sense is when you're hundreds of kilometres seeing patients, you're not just there with your stethoscope, but you have all the tools and equipment you need to actually do your job. To close that loop from symptom to diagnosis to treatment, all within the one visit, and by doing so, potentially save a life. In fact, in the first 6 months that the Heart of Australia program was launched, 9 patients were referred for open heart surgery. 9 patients who might be dead if not for the simple fact that they stepped onto that truck when it rolled into town. 13 communities across the state, who in most cases had very little, now have at their doorstep a state-of-the-art cardiac and respiratory clinic every 2 weeks. Since launch of the program just over 3 years ago, over 4,000 patients have benefited, and we anticipate that somewhere between 120 and 150 lives have been saved. Ladies and gentlemen, I'll put it to you that if the great advances in health and medicine in our time thus far have been sanitation, vaccination, and penicillin, then the mobilisation of medicine for the masses has the potential to be equally significant. We must accept that medicine as a discipline, insofar as what it can offer humanity, we need to not just develop treatments, but find effective ways of delivering those treatments to those who need it. And when I talk about the mobilisation of medicine, I don't just mean trucks, but by whatever means, trucks, planes, boats, an army of volunteers, telemedicine, the mobilisation of medicine for the masses. And why? Because every life counts. In the words of Victor Hugo, there's nothing more powerful than an idea whose time has come. And insofar as bringing the medicine to the people, I believe that time has come. Thank you.